I'm a consultant working in emergency medicine in the A&E department. A patient came in with retrosternal chest discomfort. She was otherwise perfectly healthy, mid-20s. So after taking her history, I performed a cardiovascular and an abdominal examination. I palpated for the apex beat, I listened to her heart, I also palpated her abdomen, took her blood pressure and ordered some further tests. Towards the end of my shift, I was summoned to a meeting with my medical director and the head of HR. And they said that an allegation of sexual assault had been made against me and that the matter was being referred to the police. Well, at first I thought it was absurd. And I even said, that's ridiculous. I felt sick, ashamed. I was innocent. I rang medical protection and they were able to help me straight away. I spoke to a medico-legal consultant and he was very calm and reassuring. And he said that he would help me and do everything he could. They appointed a solicitor and she was able to speak to the police and find out more about the allegation. It turned out that I had been accused of touching the patient inappropriately during the cardiovascular exam. And thinking back, I should have spent longer explaining what it was that I was going to do during the examination. And also I should have offered a chaperone. But all the nurses were very busy, and for a quick cardio exam, it didn't even cross my mind. The solicitor helped me draft a statement to put forward my side of the story. She talked me through police procedure and told me what was going to happen during the interview. It was a pretty awful experience, but I think it would have been much worse had I not known what to expect. The solicitor, she was there with me the whole time, which was great. I read out my statements, I answered some questions, and then I was told I could go. I found out a few days later that no further action was going to be taken. I can't describe how it feels to be accused of something like that. I mean, it was a misunderstanding, but it was one that landed me in a pretty awful situation, and I was in a dark place for a while. But I will be forever grateful for the counselling that medical protection organised for me on my behalf. Of course, as a consultant, the possibility of complaints comes with the job. But this incident made me much more aware of the risk. The whole situation could have been much less likely by offering a chaperone. I now know how valuable my medical protection membership is. Fortunately, nothing came of this allegation, but it's a relief to know that the support is there. It's not something I would want to go through alone.